Welcome to our presentation on the COVID-19 vaccine. We're a part of the outreach and education team from the Division of Public Health Services in the state of New Hampshire. And today we'll be sharing some information with you about the COVID-19 vaccine. First, let's discuss New Hampshire's vaccine rollout. The COVID-19 vaccine rolled out in New Hampshire in 3 separate phases. We are currently in phase 3. On April 2nd, vaccine became available to all New Hampshire residents. On April 19th, vaccines became available to all people in New Hampshire regardless of residency. Now let's talk a little bit about the COVID-19 vaccine. COVID-19 vaccination is a safer way to build protection. Getting the virus that causes COVID-19 may offer some natural protection, known as natural immunity, but experts don't know how long this protection lasts. The risk of severe illness and death from COVID-19 far outweighs any benefits of natural immunity. COVID-19 vaccination will help protect you by building immunity without the risk of severe illness. Over 245 million doses of COVID-19 vaccine were administered in the United States from December 2020 to May 3rd, 2021. It's easy to be confused by all the information that's circulating, some of which may be conflicting. The Centers for Disease Control and Prevention, the CDC, has laid out some facts to counteract common myths. Let's start with some of these facts. The first is that getting vaccinated can help prevent you from getting sick with COVID-19. Next, we know that people who have already gotten sick with COVID-19 should still get vaccinated. Another fact is that COVID-19 vaccines cannot give you COVID because the vaccines do not contain the live virus. Lastly, COVID-19 vaccines will not cause you to test positive on any of the viral tests, like a PCR or antigen test. The key messages and takeaways from this presentation are that there are 3 currently authorized COVID-19 vaccines for use in the United States. The 3 vaccines are Moderna, Pfizer, and Janssen. The Janssen vaccine is also known as Johnson & Johnson, or J&J. The CDC does not express a preference for one vaccine over another, and that's because all 3 COVID-19 vaccines are safe and effective. It's important for people to be vaccinated quickly and take the first available vaccine offered rather than wait to choose a vaccine. The vaccines have many similarities, so let's talk more about the safety and effectiveness of the 3 vaccines. The U.S. vaccine safety system ensures that all vaccines, including the 3 currently authorized COVID-19 vaccines, are as safe as possible. COVID-19 vaccines are being held to the same safety standards as all other vaccines. Several expert and independent groups evaluate the safety of vaccines being given to people in the U.S. The Food and Drug Administration, the FDA, carefully reviews all safety data from clinical trials. The vaccines were evaluated in tens of thousands of participants in clinical trials, and they meet rigorous scientific standards for safety, effectiveness, and manufacturing quality. These vaccines have undergone the most intensive safety monitoring in U.S. history. The FDA and CDC closely monitor safety and side effects. The results of ongoing safety monitoring are reassuring. Even after a vaccine is authorized or approved for use, many vaccine safety monitoring systems watch for adverse events or possible side effects. This continued monitoring can pick up on adverse events that may not have been seen in clinical trials. So if an unexpected adverse event is seen, experts can quickly study it to further assess whether it is a true safety concern. Experts can then decide whether to change the recommendations for the vaccine. This monitoring is critical to help ensure that the benefits continue to outweigh the risk for people who receive the vaccines. There are several big ongoing safety monitoring systems. Some examples are listed here on the slide. The newest safety monitoring system is CDC's vSafe program, a text messaging system. This monitoring is extremely important, and the results let us know that the COVID-19 vaccine is safe and effective. COVID-19 vaccine science. Now we're going to talk about the differences and similarities between the vaccines. While all the vaccines are safe and effective, they work in different ways. There are two different mechanisms for how they work. The first type of vaccines are mRNA vaccines. They both require 2 doses, and they also require extremely cold storage. While this is the first licensed mRNA vaccine, mRNA vaccines have been studied for decades in vaccine trials for flu, Zika, and rabies. Lastly, there are no safety concerns identified with these COVID-19 mRNA vaccines. So how do mRNA vaccines work? First, let's talk a little bit about what the virus looks like. COVID-19 is a coronavirus, just like the common cold is a type of coronavirus. You can see an illustration of a coronavirus in the top right corner in the orange drawing. Coronaviruses are known for their crown-like spikes on the surface called spike proteins. A spike protein is what's highlighted in the magnifying glass in the illustration. Spike proteins are what the vaccine targets. Now that we know a little bit about what a spike protein is and what the vaccine targets, let's talk about how this mRNA vaccine actually works. mRNA is messenger RNA, and it's a genetic material that tells your body how to make proteins. The vaccine is made up of mRNA wrapped in a coating, so it's easy to deliver into the body. Then, the mRNA in the vaccine teaches our cells how to make copies of the spike protein. This way, if you're exposed to the real virus later, your body will recognize it and know how to fight it off. It's really important to remember that the vaccine does not contain any virus, so it can't give you COVID, and it can't change your DNA in any way. In fact, after the mRNA delivers these instructions, our cells break it down and get rid of it. The next type of vaccine that we're going to talk about is a vector vaccine, and that's what the Janssen, also known as J&J or Johnson & Johnson vaccine is. This vaccine is a single-dose vaccine, and it's stored at refrigerator temperatures. This type of vaccine has been used in other vaccines, such as the Ebola vaccine. Common side effects are similar to those of Pfizer and Moderna vaccines. The vaccine is safe and effective. The rare clot platelet event, which we'll discuss more on the next slide, was evaluated and considered so rare as to warrant continued use of the J&J vaccine. Latest J&J vaccine updates as of May 4th. Recent updates regarding the J&J vaccine show that ongoing attention to vaccine safety and transparency is extremely important, and safety monitoring systems are working. A very rare side effect after receiving J&J vaccine was reported, and the CDC and FDA recommended to pause use of J&J while evaluating the situation. They have since recommended that the J&J vaccine can be resumed. Here's a situational summary. On April 15th, CDC and FDA recommended to pause use of J&J vaccine after identifying 6 cases of a very rare but severe syndrome of blood clots with low platelets out of the nearly 7 million J&J doses administered nationwide. After experts met to review safety data, CDC and FDA recommended that the use of Janssen COVID-19 vaccine resume in the United States effective April 23rd. However, women younger than 50 years old should be made aware of a rare risk of blood clots with low platelets following vaccination and the availability of other COVID-19 vaccines. This risk has not been seen in the mRNA vaccines, Pfizer and Moderna. Now let's talk about how these viral vector COVID-19 vaccines work. A viral vector vaccine uses a harmless version of a different virus, called a vector, to deliver information to your body to protect you. Similar to the mRNA vaccines, this vaccine teaches your body how to make copies of the spike proteins. Similarly, if you're exposed to the real virus later, your body knows how to fight it off. The vaccine does not contain the virus that causes COVID-19, and it also can't make you sick from the virus that's used as a vector. Just like the other vaccines, it won't change your DNA in any way. All 3 of the COVID vaccines were tested in large medical trials to make sure that they met safety standards. Many people were recruited to participate in these trials to see how the vaccine offers protection to people at different ages, races, and ethnicities, as well as those with different medical conditions. About 30% of US participants were Hispanic, African American, Asian, or Native American, and about half were older adults.
This is a table that shows you the comparison between the 3 different approved vaccines. I want to draw your attention to the high efficacy, meaning how well it works, for all 3 of the vaccines. They are all very effective at preventing severe disease, hospitalization, and death.
The key message worth repeating is that all 3 COVID-19 vaccines are very good at preventing disease, and they're also very good at preventing severe disease, hospitalization, and death. How many doses do I need and when? It takes time for your body to build protection after any vaccination. COVID-19 vaccines may take up to 2 weeks after your last shot to fully protect you. The Moderna vaccine requires 2 doses for full protection, as does the Pfizer. And it's recommended that Moderna can be given in about 28 days apart and the Pfizer about 21 days apart, although it could be longer than that if needed. The Janssen, also known as the Johnson & Johnson vaccine, is a 1-dose vaccine. The vaccines are not generally interchangeable, so for example, if you get your first dose with Moderna, your second dose should also be Moderna. What about side effects? Certainly, you may have some side effects, which are normal signs that your body is actually building protection. These side effects may be on the arm where you got the shot, like pain or swelling. Side effects could also be throughout your whole body, like fever, chills, fatigue, or headache, but these side effects should go away in a few days. Most side effects last 1 to 3 days. These side effects are a sign that your body is building protection and your immune system is responding. Remember that the COVID vaccine will help protect you from getting COVID-19 disease. So even though you may have some side effects, this is much better than the risk of actually getting COVID disease. Now let's talk about some myths and some facts about COVID-19. Let's start with the facts. The first fact is that none of the authorized vaccines contains any of the live virus. This means none of them can make you sick with COVID-19. The next fact is that there's no evidence suggesting that fertility problems are a side effect of any vaccine. COVID-19 vaccines have not been linked to infertility or miscarriage. Another fact is that the COVID-19 vaccines given to correctional facility residents and staff are the same vaccines that will be received by other community members. They're not of lesser quality, they're the same vaccines. We discussed safety more in depth in the earlier slides, but remember that COVID-19 vaccines are safe and effective. The speed of the vaccine's development was due to reducing administrative bureaucracy, not by bypassing any safety precautions. The COVID-19 vaccine didn't cut corners on safety. The vaccines were still held to the same safety standards as all other vaccines. And lastly, thinking back to our slides on vaccine science, the COVID-19 vaccines don't change or even interact with our DNA. The vaccines teach our bodies how to protect against future infection. Hopefully, outlining some of the myths versus facts helps you gain a better understanding of the COVID-19 vaccine. It's difficult to know which sources of information you can trust, so make sure that your information sources are credible. We hope that this presentation helped you understand a little bit more about the COVID-19 vaccine so that you feel empowered to make a choice about if you want the vaccine. Here are some of the resources we used in this presentation for more information. Thank you for listening.